Hello, today we're going to talk about test-taking strategies as one of our study skills review modules. We'll talk today about some of the common mistakes made during test-taking. We'll talk about some behavioral issues that may be occurring during testing versus some of the knowledge-based challenges that students may have. We'll talk about some test-taking strategies, and then also a little bit about test anxiety. Before the exam, you shouldn't be studying at the last minute. Something you want to do is you start from the first day of class. You review your notes, you review your lecture notes, you may review that same information out of your textbook. But that way you're studying a little bit at a time and not leaving everything for the last minute. Your reviews for exams should be a regular part of your study schedule. So, reviewing for an exam is much more than reading or rereading assignments. It should be, it should include self-assessment. And there's another module that you'll be participating in regarding self-assessment. So rather than just glancing through your notes or glancing through the lecture, glancing through the book, you want to assess yourself. You want to quiz yourself. You want to write test questions as you're studying through your notes, or you may want to work with a study group or a study partner that is going to quiz you to see how much you really have retained and know about whatever topic you're being tested on. I mentioned this a little earlier about studying for short periods at a time rather than one very long period. You don't want to let yourself get fatigued. You don't want your brain to be fatigued. It's much more effective if you do several short periods. Okay. This also goes into some of the self-assessment, but you may turn any headings, any major concepts, any major topics into test questions, and think about outlining those, with possible answers, how those questions may even be asked, whether, it might be a true false or multiple choice, or would I have to list all these possibilities? Start thinking that way as you start to review your notes. Some people, love using that traditional flashcard type of studying, and that can be very helpful. Make sure you're not just memorizing, though, and we'll talk a little about that in the next few slides. So, one of the things that you can do too much of before or while studying for the exam is spending too much time on what you already know. So if you're pretty comfortable with some concepts, you don't want to skip it overall. You want to review it, but you don't necessarily want to spend a lot of your time on that. And you're better if you spend time on the things that you're struggling with. Okay, and there may also be some of those detailed facts that are something that maybe you'll never get. And I'm not discouraging you from studying, but especially when you're getting toward that 11th hour, you may not want to spend a lot of time on those things that you just feel like is never going to stick in your brain. The other things that you can do prior to an exam is prepare mentally. So think positively, avoid negative mental dialogue. If you continuously tell yourself, I'm going to fail, I'm going to fail, I'm going to fail, more than likely you're not going to do so well. Okay? Another important thing is to prepare physically. Get plenty of sleep the night before, and technically every other night as well. Make sure you eat well, you exercise, and you're hydrating. Relax before the test. You should never be cramming at the last minute. So whatever allows you to relax, whether it's maybe listening to music, meditating, some deep breathing exercises, going to your happy place wherever and however that may be. Just kind of get yourself calmed down before the test rather than frantically cramming at the last second. During the exam, you want to read the directions carefully. Unfortunately, if you don't, there may be some lost points because you're not quite following the directions. It's a real good idea to preview the entire test first, and you get an idea of how much time you're going to have for each question. And the other thing that you can do is work on some of the easiest questions or easiest parts first. If you've ever watched a show like Who Wants to Be a Millionaire, they ask the simpler questions first, and then they get harder and harder. But what that does is it kind of helps calm you down. It gets you a little more confident and prepares you a little bit better for the more difficult questions. Okay. This doesn't happen often, but find out if you're penalized for any incorrect responses. If you are, you may want to avoid guessing, because if you get it wrong, you might lose a point. With answering essay questions, you might want to either use the hard copy of the test, or if you're allowed a piece of scratch paper or a whiteboard, is kind of write out an outline before you begin writing the entire essay. This helps you kind of organize your thoughts. It'll make writing the entire essay question a lot easier. And finally, be sure to make your writing legible. Okay, if your instructor can't read the answer, then it would be all for naught. At the very end of the exam, take a few minutes to go through. Make sure you've answered all the questions. Make sure that if it's a Scantron or some other type of bubble sheet, that every answer is completed. I've had students that have missed entire pages of exams, so make sure that everything is complete before you submit it. While taking the exam, we're going to approach this. This is primarily for multiple choice questions. So you're going to read the question. Of course, you want to understand what that question is asking. You're going to take keywords out of that question. So if you had a question about perhaps a woman who walks her standard poodle every day at 8 a.m. has high blood pressure, the things that may be important is the fact that she's a woman, and if they state her age and that high blood pressure. The fact that she walks at 8 a.m. and that she has a standard poodle may not really be significant. So you want to pull out those keywords, those things that you need to answer the question. So on your test, you can highlight them, circle them, underline them, whatever kind of makes them stand out to you. Be careful with any qualifiers. Always, never, the least, the most, the best. They can often change the meaning of a question, and nothing worse than getting the least and the most mixed up in a question, and it's happened to all of us. After you read the question, you pull out the key words. See if you can answer that question before you look at any of the answer options. Try to anticipate that. If it's a patient scenario-based type of question, try to visualize that patient or what that treatment might look like or that position might look like. And try to answer the question before you get the answer options in your head. So you kind of want to hide all the options, and then you're going to, as I answered before, then you're going to look at one answer option at a time. So you're going to look at the first one. And if it could be a plausible answer, if it kind of makes sense, and you may want to rule it in. If it really doesn't make sense, you'll rule it out. And you'll do this with each and every answer option. So if it's A through D, answer A, rule in, rule out. Answer B, rule in, rule out. C, etc. More than likely, you'll finish that question and you'll have two possible answers that you've ruled in. Take each of those two one at a time and insert it back into the question. So answer A, you put back in the question. Does that make sense? Yes or no? And the other question, or the other answer that you may have chosen may have been C. Now insert that into the question. Okay, now which one makes more sense? Things to avoid. Avoid that mental dialogue. Like I said earlier, that negative dialogue is never helpful. But also don't question yourself. Don't dig so deep that you're going beyond what the question is asking you. Don't talk yourself out of an answer, all right? If you truly don't know an answer, don't panic. You mark it, and then you move on. And you can always come back at it, or come back to it. Maybe your confidence is a little bit better, and there may be another question on the test that kind of gives you a little bit of a hint to that first question, or the answer may just pop into your head after some time. So, common mistakes: not reading the question completely. Again, there may be a qualifier towards the end of that question that's going to change the question. It may not truly be asking what you think it's asking if you only read the first half of the question. So make sure you read the answer, or read the entire question. And then not reading the answers completely. Again, that first part of the answer may seem correct, but the end may be the opposite. So be really careful. And again, read one at a time so that you can concentrate on each and every answer. Be careful with answering questions based on a clinical experience. Of course, clinical experiences are great, but especially when taking a final exam or a licensing exam, clinicals or things happening out in clinic are going to be different. You need to go back to your textbooks. You need to go back to what you were taught in your program to answer the questions on those types of exams. Another common mistake is seeing a possible answer without fully examining all the other options. Make sure you go through all your possible options before you select an answer. Overthinking the question. Again, everything you need to answer that question is going to be in the stem of that question. So if you start digging too deep, you're probably missing something. Go back, read the question again, and double check your keywords. Not understanding or being able to justify your selection. That usually happens with guessing. If you truly don't know it, you don't get penalized for guessing. By all means, guess. It's better than leaving it blank. But when you go back, see if you can justify that selection. If you can't, you may want to look at your other answer options. And that's, again, towards the end if you have time. And I've already talked about not reading into questions. So we're going to take a little break right now. And I want you to reflect on maybe some of your own test-taking habits. Do you not read the question completely? Do you not read all the answer options? Do you tend to read into the question too much? Think about these possible things, because these things can be changed. They definitely take some really active work, but this is a great thing to bring up to instructors, advisors, program directors, someone that can maybe help you find different strategies to combat the behavioral challenges. Anyway, I'm going to give you a few minutes to look at this and think about this, and then I will be back with part 2. Thank you.